This goes back to, based on the literature, there's a 1980 paper that was in the New England Journal of Medicine where a physician published that opioid addiction was very low in hospitalized patients who were given opioids. And with that statement and it being in a big journal way back then, a lot of drug companies and other researchers kind of misconstrued that notion and took it to mean that if you give opioids to patients, they are not addictive. So then, my understanding is pharma started advertising in the 90s about non-addictive opioid pain medication, and that's kind of what has led to what we're in right now, because we routinely prescribe opioids for minor surgeries, ambulatory outpatient surgery when the patients don't really need it. So giving them that supply of tablets that they don't use basically increases the chance of those things getting abused or diverted. And when we say diverted, it just means they're using the medicine for not the prescribed reason, or friends are using their supply. So we noticed in our patient population that when we would see our patients after surgery in clinic and we asked about pain control, a large number of them, specifically those who underwent minimally invasive surgery, said they didn't use any of the opioids that we prescribed. So we thought about that, and with the opioid crisis being all over the news, we thought about how we could affect it. So we decided to completely eliminate routine prescriptions of opioids for certain surgical cases. So the minimally invasive surgeries such as laparoscopic surgeries, robotic surgeries, and in our ambulatory outpatient surgeries, we stopped prescribing opioids. And we actually informed the patients before surgery when we saw them in clinic that, hey, routine postoperative pain is going to be managed effectively with non-opioids. So we set the expectation. And then if they were admitted, if they didn't use, we picked a number 5 doses. So if they were admitted to the hospital, had laparoscopic surgery or minimally invasive surgery, if they used more than 5 doses, whether it was an oral opioid or an IV opioid, then we would give them a very small 3-day supply of only 12 tablets.